Hi, in this video I'm going to discuss what I would call an entry-level side kick. Now this is based on the work of people like Alison Grimaldi, who is an Australian physiotherapist, and she's one of the world's leading experts on the management of lateral hip pain. Now often when people can't do side-lying exercises in Pilates, it's because of extensive deconditioning and pain and problems with, amongst other things, the tendons of the gluteal muscles, which start off in that kind of lateral back pocket area and wrap over the lateral hip and attach into various places on the lateral hip, notably the greater trochanter of the femur. Now where there is extensive deconditioning or what's known as tendinopathies, a problem with the tendons for those gluteal muscles, it's typically twinned with irritation or compression or chronic irritation to the bursa, the cushioning pad, over the bony prominence on the outside of the hip. And you may have heard terms like trochanteric bursitis or gluteal tendinopathy. The umbrella term these days is more often than not lateral hip pain, because it can be comprised of many different aspects and there's no real kind of one isolated pathology at play. So when it comes to something like Pilates side kick, where there is flexion and extension of the hip in a side-lying position, or exercises which can be very provocative like clam sequences, there is typically a lot of compression and movement over the very area which is causing the problems. And it's something I've seen a great deal of in my Pilates experience, is people will push through this kind of chronic searing, burning pain over that bony prominence, thinking that it's this kind of muscle burn and this kind of use it or lose it mentality and one more repetition mentality, and actually it's one of the worst things you can do if you are affected in that way. Now, how would you diagnose those sorts of things? Well, chiefly it will be if you're trying side-lying exercises and it's really blooming painful, or it becomes that way very quickly, there's a fair chance that the structures involved just don't have the capacity to do what you're asking them to. You can get this sort of thing diagnosed clinically with ultrasound imaging and clinical assessment. A lot of the time, if you're at rest and you just press into that bony prominence or just behind it and it's exquisitely tender, that's also quite a kind of valid clinical test for the presentation of gluteal tendinopathies, etc. So that kind of rather long-winded introduction is just to say that if you have that, it's actually very common, you're not alone, it's something which an awful lot of people have. And this exercise I'm about to demonstrate, this kind of entry-level side kick, is probably one of the best ways you can try and begin the process of re-educating, re-strengthening, reconditioning the muscles and tendon units which are so commonly afflicted. I've got 2 pillows here, you'll need the same. Maybe need more, depends on obviously the type of pillow, but I'll talk through that in a little bit more depth when I see you down on your side for this introductory side kick. So when you're down on your side, you'll want your 2 pillows between your legs. And these are actually a little bit squishy, so you can see when I rest my leg fully, my top leg is actually slightly below horizontal. So because of that, I'm actually going to put in another pillow between those ones, and that should, bring my leg up to a lovely horizontal alignment. Now in terms of what's happening here, we've got the femur articulating with the pelvis, and that articulation is known as your hip joint. That hip joint wants to be neutral. If it's above horizontal in this position, the hip would be said to be in an abducted position, and if it's dropped down too low because there's insufficient lift between them, that's an adducted position, and that's the one we really want to avoid. That will be a very provocative position for those of you who've got issues with lateral hip pain or weakness in these muscles. So first things first, make sure you're comfortable, make sure you're in that neutral position. Other things which I mentioned in the video I've done on sideline setup is if you've got any pressure point issues or pain underneath that bottom hip, get some cushioning in. And then the alignment, as I've spoken about in that other video, just try and get everything into a good neutral position. Now, when you're in here, it should be a very comfortable position. These legs are supported. There's no excessive compression because of the hip being in an adductive position. We've removed that with these cushions. And this is where this entry-level side kick, this preparatory movement comes in. From here, 100% of the weight of my leg is supported by those pillars. All I'm going to do is try and take a quarter, 25% of the weight of the leg off the pillow. So this is this slight lightening of my leg, probably indistinguishable from where I started, but I'm just taking a little bit of weight. I'm not lifting my leg off the pillow. And that's where I'm going to hold. Now, ideally, I'd end up holding that position for 45 seconds. If that's unachievable, you simply do what you can before the onset of pain and serious fatigue, and then you release that leg fully weighted back down. When you facilitate the lift, a lot of people who have that deconditioning weakness in the gluteal muscles will want to try and generate most of the lift from the anterior hip and the hip flexors. And so something you'll probably encounter is rolling back and then trying to do the lift. And that switches the burden onto those anterior hip muscles. We don't want that. So if you catch yourself doing that, either do it with your back against something, the wall or a chair or something, so that you're sensing if you roll backwards, or just actively roll forwards 5 degrees so you feel a little bit more weight in the fingers, and then start your 25% lift. So there is the basic structure, holding that 25% lift and aiming to hold for 45 seconds. Now this is a little bit of a patience tester. When we go into that 25% lift, it's what's known as an isometric muscle contraction. The muscles are contracting, but they're not shortening or lengthening, they're just staying still. And that isometric muscle contraction is really the kind of first step in re-educating chronically degenerative or deconditioned muscle-tendon units. They can also be a really nice pain-relieving mechanism, which is actually a kind of cortical pain-relieving mechanism. So the isometric contractions are really good because they are a base level muscle contraction and hopefully generate some pain relieving effects. Now, it's not straightforward, it's not clear cut, and it is a bit like watching paint dry in terms of the amount and repetition you have to do. If you're going kind of really by the book in terms of isometric muscle contractions, you would hold for 45 seconds, you'd then have a 2-minute break, and then you'd repeat that process, and you'd aim to do that 5 times. So we're already looking at quite a lot of time which is being taken up with the 45-second hold and the 2-minute gap 5 times. You can do the math there. So it is something which takes quite a lot of discipline, but if you are trying to do side-lying exercises and you're just not able to do it because it's painful, because you're tiring really quickly, your muscle tendon units simply don't have the capacity and the ability to do what you're asking them to do. You have to take it right back to basics and get them confident to hold that sustained pressure and get really, really good at that before you start potentially bringing in movement or extra load by lifting more weight to a point where you could hold your leg in a position without discomfort. Now this can be a very time-consuming and frustrating process. Remember, if you've got to this point where there's that sort of deterioration and pathology and discomfort in the outside of the hip, we're not going to be able to fix this overnight. It needs a lot of patience, a lot of practice, and a lot of time to readapt those soft tissues which have become dysfunctional. This can be one of the most challenging aspects to exercise rehabilitation, is the time it takes to unpick problems which have crept in, often over decades. Okay, so if you're trying this exercise, it's actually really well researched by people like Alison Grimaldi in Australia, and physical therapists and physiotherapists globally use this sort of approach, but it needs to be done in conjunction with this re-education and this, I suppose, this enthusiastic response to say, don't worry, this is not going to be an overnight fix, but if you keep at it, this is the best way you've got of trying to get those muscles back to some sort of function. And don't give up, don't despair, don't be too despondent, because it is a patience tester. If you still have problems in that position, or any of this is just not working for you, then of course go and consult your medical professional and get the advice of somebody you trust. This is only suggested as a guide, but has proved very helpful for some of my clients over the years, and I know that it's been very helpful for clients of other people who've used it similarly. So hopefully that entry-level side kick, that isometric muscle contraction technique may be of benefit to you. If it is, keep at it. It'll take a long time, but it'll be really worthwhile.